Thyroid effects of the amiodarone. Amiodarone may cause significant thyroid dysfunction due to its high iodine content, direct effects on the thyroid follicular cells, and changes in the thyroid hormone metabolism. There are three thyroid related syndromes associated with amiodarone use. That could be amiodarone decreases the peripheral conversion of T4 to T3. So, this may result in higher T4 levels and lower T3 levels and a normal or mildly elevated TSH, but the TSH here would be less than 20 for sure. The thyroid test abnormalities are most prominent in the first 1 to 3 months after starting amiodarone and may become less apparent afterwards. These patients are clinically euthyroids and they usually do not need treatment. The next type is the high iodine content in amiodarone inhibits thyroid hormone synthesis, which can lead to primary hypothyroid. The primary hypothyroidism, which can show as decreased T3, T4, and high level of TSH. And here, what we call it as the Wolff-Chaikoff effect. And the treatment could be levothyroxine. The last one, the third one, is the amiodarone can also induce thyrotoxicosis, which we call it as amiodarone induced thyrotoxicosis or AIT. It could be type 1 or type 2, but due to either increased thyroid hormone synthesis or decreased or the destructive thyroidism. So AIT, that is amiodarone induced thyrotoxicosis type 1, it is usually because of the increased thyroid hormone synthesis, and amiodarone induced thyrotoxicosis type 2, AIT type 2, is because of the destructive thyroiditis. And in both these subtypes, TSH will be low. So if we talk about the type 1 and type 2 differences, the type 1 is iodine induced hyperthyroidism. There is excess thyroid hormone synthesis due to high iodine content of amiodarone and usually occurs in abnormal thyroid glands. Maybe, for example, they have some kind of a Graves' disease in the past, could be a latent Grave, and the treatment here would be antithyroid drugs. And talking about the type 2, it is a destructive thyroiditis, and it releases the preformed thyroid hormone due to direct cytotoxic effects of the amiodarone and usually occurs in normal thyroid glands. And the first line treatment is glucocorticoids here. And the lab values you can see here in the type 1 decreased TSH, which would be also same in type 2. T3 and T4 would be high in both the subtypes, but the differentiating factor would be the radioactive iodide uptake, which would be less in type 1 and undetectable in type 2. And the other differentiating factor would be the ultrasound, where there is increased vascularity in type 1 and decreased vascularity in type 2. Thank you.